All right, let's pull back the curtain on two of the most misunderstood conditions out there: anxiety and obsessive compulsive disorder, or OCD. We're going to dive in, separate the myths from the reality, and get a much clearer picture of what's actually going on inside the mind.
So let me start by asking you something. Have you ever had a just totally bizarre, maybe even a little disturbing thought pop into your head from out of nowhere? You know, the kind that makes you stop and go, whoa, where did that come from? Well, turns out it's an incredibly common human experience, and it's the perfect place for us to begin this journey.
This quote, wow, it just cuts right to the absolute heart of the matter. See, it's not just about a thought. It's about this overwhelming feeling of doubt, this intense sense of responsibility that practically forces you to act. That feeling of I have to, that's the engine of a compulsion, and understanding it is key.
So where does that powerful feeling come from? Well, it usually starts with one of those strange thoughts we just mentioned. In psychology, they're called intrusive thoughts. And here's the surprising part. Having them is a completely normal, universal part of being human. And this is maybe the most important thing to get right off the bat. Every single one of us gets them. A weird image, a random, out-of-character impulse, you name it. These are not secret messages or signs about who you are. Think of them like mental junk mail. They're just noise.
The real issue isn't the thought itself. It's the meaning, the weight that gets attached to it. For someone with OCD, that piece of mental junk mail isn't just noise. It's treated like an urgent 5-alarm fire. It feels like a warning of some terrible danger that is now their personal responsibility to prevent. And that brings on this massive, crushing wave of guilt.
And that intense feeling of responsibility, right there, that's the fork in the road. It's where general anxiety and OCD, which can sometimes feel really similar, actually head down two very different paths. So let's take a closer look at that split.
Okay, so with generalized anxiety disorder, or GAD, you might have this kind of free-floating worry that latches onto all sorts of things: your job, your health, your family. The worry is the main event. But with OCD, it's way more specific. You get an intrusive thought, an obsession, that triggers a huge spike of anxiety, and that anxiety then demands you perform a certain action, a compulsion, to make it go away.
And this is how it becomes such a vicious cycle. Honestly, it's a clever but pretty awful trap the brain sets for itself. First, the intrusive thought hits. Second, you feel this unbearable anxiety. Third, you do the compulsive behavior to get rid of the feeling. And fourth, you get a moment of relief. But here's the catch. That relief reinforces the whole loop. It teaches your brain the wrong lesson. Hey, that ritual worked. We have to do it again next time.
Now, these compulsions can look like a lot of different things. We all know the classic ones, right? The constant hand-washing, checking the stove a dozen times, arranging things just so. But they can also be more subtle, like constantly asking someone, "Are you sure this is okay?" or "Did I do that right?" That search for reassurance is also a compulsion, a behavior designed to quiet that inner alarm.
This brings us to a really common misconception I want to clear up. Maybe you've heard the term pure O, for purely obsessional. The name kind of implies there aren't any compulsions, but that's just not true. The C is absolutely there, it's just happening inside your head. It's things like mentally replaying a conversation for hours, trying to find certainty, or silently arguing with a thought. The ritual is invisible, but the cycle is exactly the same. So you might be thinking, if so much of this is internal and invisible, how on earth does a clinician understand how bad it is? I mean, how do you measure something like distress? Well, there are actually tools for that. Psychology has developed some really clever, highly structured ways to quantify the impact of OCD. This isn't just about guessing how someone feels. It's a systematic way to assess just how much these symptoms are getting in the way of a person's life.
And this table gives you a great idea of how it works. A tool like the Yale-Brown Obsessive-Compulsive Scale, the Y-box for short, asks very specific questions. Things like, how much does this interfere with your work? How distressing is it really? How much control do you feel you have? By scoring these answers, a clinician gets a clear, objective number that shows the severity. It's a brilliant way to track whether treatment is actually working over time. And speaking of treatment, progress is absolutely possible. But here's the big paradigm shift. The goal of modern treatment isn't to get rid of the thoughts. It's about retraining your brain's response to them.
The gold standard for treating OCD is a therapy called exposure and response prevention, or ERP. And honestly, the name tells you exactly what it is. You gradually expose yourself to the things that trigger your anxiety, and then you prevent the compulsive response. It is the most direct way to break that vicious cycle we looked at earlier.
The whole point isn't to never feel anxious again. The point is to teach your brain that anxiety, while it feels awful, is not actually dangerous. It's just a feeling. And if you can learn to just sit with it, without doing the compulsion, you discover something amazing. It eventually peaks and then fades away all on its own. Your brain learns a powerful new lesson. Hey, I can handle this.
There's another really powerful approach too, called acceptance and commitment therapy, or ACT. With ACT, the strategy is a bit different. It's less about direct confrontation and more about changing your relationship with your thoughts. You learn to notice them, acknowledge them without judging, and then just let them pass by without getting all tangled up in them. The metaphor is beautiful. You learn to see them as just clouds floating by in the vast sky of your mind.
Now, effective management is almost never about finding one single magic bullet. It's really about building a complete toolkit that's tailored for you.
So therapy is really the cornerstone here. But things like medications, specifically SSRIs, can be a massive help. Add in lifestyle factors like regular exercise to lower your baseline anxiety, and you have a really potent combination. But, and this is crucial, this whole process needs to be guided by a trained professional who knows what they're doing.
This quote is just a perfect description of what medication actually does. See, it doesn't make the thoughts go away. What it does is turn down the volume of the anxiety they cause. It gives you just enough breathing room, that little bit of space you need to resist the compulsion and actually use the skills you're learning in therapy.
And this chart shows you exactly why that combination is so powerful. Medication on its own helps, for sure. Therapy on its own is often even more effective. But when you put them together, that's where you frequently see the best results. They support each other and create a powerful synergy.
So it's really important to frame recovery in the right way. The goal isn't to magically erase intrusive thoughts from your brain forever. Nobody has a mind like that. The real goal is to get to a place where, when those thoughts do pop up, they just don't have any power over you anymore. They become background noise again, instead of the thing that's running your life.
And that really leaves us with this final, powerful idea to think about. What if the whole battle was never about controlling our thoughts in the first place? What if it was always about learning to control our response to them? Because when you make that shift in focus, that is an entirely new path to freedom.